So, ang subject po natin today ay musculoskeletal. So, magsisimula tayo sa fracture. By the way, this is a combination of season 8 and 9 na musculoskeletal system. So, first, fracture. Fracture defines as break in the continuity of bone metabolism. Again, ang nangyayari dyan, nagbe-break sa fracture, nagbe-break yung bone. So, hindi rin nagpa-process yung bone metabolism. So, ang common cause ng fracture ay trauma and yung mga disease conditions like osteoporosis, osteomalacia, ganun. Ganun yung mga common cause ng fracture. So, what are the signs and symptoms of fracture? First is yung soft tissue edema. Next is pain. Pain is sharp and continuous. So, kapag nakaka-experience ka na ng ganun, possible na fracture na yun. Another is asymmetry, yung hindi siya pantay. Next is crepitus, o ang tinatawag, o kung may other terms sa Netflix and Clex ay creaking sound. So, ayun. Next is ecchymosis o bruising. And then lastly, deformity. So, para mas madali siyang tandaan, meron tayong tinatawag na spaced. So, given na SATA o select all the apply, tandaan mo lang yung word na spaced with ed. So, spaced. Kasi diba sa fracture may spaced. So, spaced. S stands for soft tissue edema. P stands for pain is sharp and continuous. A stands for asymmetry. C stands for crepitus or creaking sound. E stands for ecchymosis or bruising. Lastly, D stands for deformity. So, yun yung mga signs and symptoms ng fracture. So, based on INAP, ang initial management kapag may fracture, ang unang-una mong gagawin is, sabihin na natin meron tayong tinatawag din na word na ISCA, I-S-C-A. So, I stands for immobilize. So, dapat i-immobilize mo muna siya. S stands for support o i-splint para lalong hindi siya magalaw. So, immobilize, support, and next C stands for cover with sterile gauze. Tandaan na ang ipang-cover mo ay dapat sterile gauze. Sterile gauze. And lastly, A, assess mo yung distal pulses. Ulitin natin na ang initial management sa fracture, first is to immobilize, second is to support or splint, third is to cover. Iko-cover mo siya para wala na pumasok na infection. Cover with sterile gauze. And lastly, assess the distal pulses. So, ito yung general plan of care. Ay, yung kaninang ISCA pala o ISCA ay sa simplify. So, itong plan of care is from INAP. So, yun nga, gaya nga sinabi ko kanina, ISCA. So, ang priority kapag si patient ay merong fracture is to immobilize. Apply splint. Immobilize, support, yan yun. So, immobilize, mag-a-apply ka ng splint para ma-prevent yung pag-dislodge ng fats. Kasi kapag nag-dislodge yung fats, possible na magkaroon ka ng fat embolism and worse, mag-progression into pulmonary embolism. So, yun. Priority is to immobilize yung affected part And by saying immobilize, mag-apply ka ng splint. Next, pangalawa, administer ng oxygen. Kasi, common sa patient na may fracture, nagkakaroon sila ng dyspnea. Third is to check the distal pulses. Yan yung sinasabi ko kanina. I-check mo yung pulse below the affected part or distal to the affected area para malaman mo kung may circulation pa ba. And fourth is x-ray para makikita mo doon kung may fracture ba talaga, para ma-verify mo if fracture yon. So sa NCLEX walang x-ray, so makikita natin doon Roentgenogram. Again, ang last na management sa fracture is surgery. So ano yung surgical management ng fracture? We have reduction and fixation. So si reduction, nahati siya sa dalawa. Meron tayong closed and open reduction. Pag closed, sa reduction, ginagamitan siya ng manual manipulation. It is guided by x-ray or Roentgenogram, while yung open, syempre, bubuksan yun. So, open bone surgery that goes hand in hand with internal fixation. So, ang purpose nun is to permanently restore yung bone metabolism. So, meron tayo dito, to open reduction. Ito yung sinasabi na open reduction goes hand in hand with internal fixation. Kaya may tinatawag tayo na pinagsama sila na ORIF. O-R-I-F. So, ayan, magkakaroon ng incision and then i-fix siya. Kasi kapag close reduction, ayan, hindi mo naman kailangan i-open. So, kailangan mo lang siya, like, i-manipulate manually nang hindi ka gumagawa ng incision. So, ayan. Pero, ang purpose nga niyan ay to permanently restore the bone metabolism. Again, yung open goes hand in hand with internal fixation. Kaya, may tinatawag tayo na ORIF. So, yung pangalawang type ng surgery is fixation. Ito na yung gumagamit tayo ng pins, wires, and metals. So, again, meron dalawa ding uri ng fixation. We have external fixation and internal fixation. Sa external fixation, gumagamit ng apparatus to achieve freedom of movement. While the internal fixation, ginagamit lang siya for bone remodeling. Yung isa kasi external para for freedom of movement, and yung internal naman for bone remodeling. So again, yung internal fixation goes hand in hand with open reduction. Ito, may example din. Alam ko ito, external fixation. Ayan, screws are placed into the bone above and below the fracture. Ayan, ito kasi yung fracture, di ba? Ayan, above and below the fracture, and a device is attached to the screw from outside the skin where it may be adjusted to realign the bone. So, yan. Ito na yun yung, ayan, sinasabi ko, use of apparatus to achieve freedom of movement. Ayan, gamit sila ng screws. And, ayan, may device na naka-attach dun sa bone para ma-adjust siya o ma-realign. So, ano yung mga complications ng fractures? First is pulmonary embolism. Makikita natin ito mamaya sa mga types ng fracture, si pulmonary embolism. Pero ito, isa to sa complication ng fracture. Cause nito, fracture on the long bone sa femur part. Tandaan natin na possible na magkaroon ka ng pulmonary embolism kahit nagka-fracture ka lang. Kasi kapag pero hindi lang basta-basta fracture, ha? Specifically sa long bone, sa femur. So, in signs and symptoms, of course, the petechial on the neck and chest o ang tinatawag din na pinpoint rashes sa neck and sa chest. Ibig sabihin nun na apektado na yung lungs mo. May possible na nakakuha ka na ng complication na may pulmonary embolism ka na. Another is the OB, of course, lungs is affected, restless, and altered level of consciousness. Initial management dito, of course, dahil lungs ang affected, O2 tayo. Hindi natin uunahin yung hindi natin uunahin muna yung immobilize. Direct tayo sa O2 kasi nasa pulmonary embolism ka na hindi na binabanggit yung fracture So, pero ang priority management natin, of course, is to report to healthcare provider. Initial lang si O2. Kapag nakaka-experience na siya ng mga ganyan, DOB yan. Another, pangalawa na complication is delayed non-union o ang tinatawag na hindi nag-heal yung fracture. So, failure of the bone to heal within 6 months. Hindi ba siya nag-heal ng 6 months? So, kapag within 6 months, wala pa rin yun, hindi pa rin siya nag-heal, yun ang tinatawag na complication na delayed non-union. So, ang management natin dito, of course, is open reduction, internal fixation. Third is avascular necrosis. Yun cell death ka na due to lack of circulation. Kaya, important din na i-assess natin yung distal pulses na dun sa affected area. Management is debridement. Again, ang management ng avascular necrosis is the debridement. Fourth is osteomyelitis. Osteomyelitis, itis, of course, pag itis, infection yan. So, osteomyelitis is infection in the bone. Signs and symptoms, automatically, kapag may infection is sore throat, fever, and of course, dahil apektado ang bone pain. Ang management natin sa osteomyelitis, dahil nga infection siya, automatically antibiotic. So, it should be broad spectrum antibiotic. Ano yung mga antibiotic na yon? Aminoglycosides. So, yun yung mga may mycin. Aminoglycosides. Again, aminoglycosides. So, kapag nagtitake tayo ng aminoglycosides, i-check natin yung urine output ni patient and kung may na-experience ba siyang tinnitus. Kasi lagi natin tatandaan na ang aminoglycosides o yung mga mycins, they are nephrotoxic and ototoxic. So, pag ototoxic, possible na makakarinig ka ng yung ringing sa ear or tinnitus. Hepatotoxic din siya. So, toxic siya sa ating liver. And lastly, nephrotoxic. So, toxic siya sa kidney. So, ang gagawin natin is to check the urine output ni patient. Okay? So, other management ng fracture, we have cast. Kasi dalawa yan, may cast and may traction. So, magsisimula tayo sa cast. Cast, ang tinatawag na immobilizer. Para ma-immobilize, di ba? Isa yan sa management. Talaga, kanina, nakalagay dito na immobilize. Pero, ayan, immobilize, support, cover with sterile gauze, and assess distal pulses. So, eto. Meron dalawang types ng cast. We have plaster of Paris and fiberglass. So, ito yung example ng plaster of Paris. Yan. Ano siya? Puti. Ito, may iba-iba siyang kulay. So, plaster of Paris is dirty white. Ito kasi, parang iba-iba kulay natin. Can be blue, pink, green. So, sa material ng plaster of Paris, they use wool or cotton. Tapos, ang drying time niya, 2 24 to 48 hours. Tapos, syempre, dahil kumpara sa isa, mas matagal siyang mag-dry. Cheap lang naman yung cost niya. So, affordable. And then, yung weight niya, heavy. So, sa fiberglass naman, ito, iba-iba kulay na ito. As you can see, may makikita rin kayong pink or other colors niyan. And gawa siya sa polyurethane. Polyurethane. Tapos, nagda-dry siya within 30 minutes. And then, it's, of course, expensive and lightweight naman siya. Again, ulitin natin, without looking. Ang plaster of Paris is gawa sa, ang material niya na ginagamit sa kanya ay wool or cotton. Ang drying time niya is within 24 to 48 hours. And cheap lang siya. So, hindi siya mahal. And then, heavy siya. Mabigat. So, ang fiberglass naman, may iba-iba siyang kulay. Kasi ang plaster of Paris, dirty white yan. Dahil, yun nga, kung i-imagine mo naman yung itsura ng wool and cotton, of course, yun white, dirty white, yun yung maisip mong kulay. So, sa fiberglass, ang material na ginagamit sa kanya ay polyurethane. Of course, mahal siya. And ang drying time niya is 30 minutes lang. Mabilisan lang. And then, ang weight niya ay very light lang naman. So, ang plan of care sa cast, kapag may cast ka, meron tayong may word tayo na ginagamit na casted. C stands for clean using damp cloth. So, dapat damp cloth or microfiber. A is to assess for signs and symptoms of infection and distal pulses. So, assess mo kung may infection ba dyan sa may cast mo. And also, syempre, i-assess mo rin yung distal pulses kasi baka wala ka ng circulation. So, S is to sling or support. And then T, turn affected side every 2 hours. And then, E stands for elevate the affected part. Ganyan. Nakikita natin sa picture. And then, D, dry the cast. Pero, i-dry mo siya. You can use blower, pero in cool setting lang. So, again, we should clean the cast using damp cloth or microfiber. And then, assess din natin kung may infection ba. And also, i-assess natin yung distal pulse para ma-check natin kung may circulation ba. Baka mamaya may compartment syndrome na. So, S is to sling or support. And then, T is to turn the affected part every 2 hours. And then E, to elevate E stands for elevate the affected part. And then D, of course, to dry the cast. And you can dry it using blower but in cool setting. So, ano ang complications kapag may cast? Meron tayong 2 complications kapag may cast. First is compartment syndrome. Yun yung parang pakiramdam na para kang nakukulong. Like, sobrang higpit niya. Yan, may pressure doon sa affected part. So, ang compartment syndrome ay ang tinatawag na a pressure that cannot escape. So, may tactile disturbance din. So, ang cause niya, of course, tight cast. Kasi, kaya nga nakaka-feel ka ng pressure eh. Tight. Mahigpit yung pagkakakas sa'yo. So, merong 6 P's sa compartment syndrome. Ang 6 P's na signs and symptoms ng compartment syndrome, of course, pain. may pain ka na may experience. Yung pain na yon, it cannot be relieved by any medication. So, kahit anong inom mo, hindi siya mawawala. Kasi, ang sakit nun ay galing sa labas. Hindi naman dahil sa may nagsisirculate sa'yo o sa loob mo. Dahil sa labas, may pressure. So, hindi mo siya marirelieve ng kahit anong gamot. Kaya, hindi mo need uminom ng gamot dito. Tapos, nag-i-increase yung pain na yon during elevation. So, kapag tinataas mo, yung affected part, mas lalo siyang sumasakit. P. Paresthesia. Isa to sa early sign ng compartment syndrome. Ang sa NCLEX, kung wala kang paresthesia na makikita, may lalabas na funny feeling, tingling sensation, o feeling na may pins and needles. Ayan. Ulitin natin na paresthesia ay early sign. And kung wala kang makikitang paresthesia, pwedeng lumabas yung funny feeling, tingling sensation, o pins and needles. Pangatlong P is pallor. Of course, dahil decrease ang blood flow mo niyan. Dahil na siya yung may pressure ba, parang sobrang tight ng cast mo. So, makikita mo na parang pale. So, pallor. And pang-apat na P is paralysis. And pang-lima, of course, pulselessness. Kaya, diba, ganyan sinasabi ko kanina, need mo talaga i-assess yung distal pulse. Kasi, ayan, pag may compartment syndrome, kapag in-assess mo, pulselessness. So, wala kang maanong pulse dun sa area na yon, near, o di kaya kahit near sa area na yon. And lastly, is poikilothermia. Ayan. Ang poikilothermia ay makikita mo na cyanotic and very cool to touch yung affected part. Kaya nga may pallor din. Ayan, pallor and poikilothermia. Tandaan natin na, okay, so isa-isa na natin yung 6 P's ng compartment syndrome. First P is pain that cannot be relieved by any medication. Also, nag-increase yung pain kapag ina-elevate mo yung affected part. Next P is paresthesia, which is early sign ng compartment syndrome. So, kung wala kang makitang paresthesia, makakita ka ng funny feeling, tingling sensation, o pins and needles. Next is pallor, o dahil decrease yung blood flow dun sa affected part, kaya pale o pallor. And then fourth, paralysis. Fifth is pulselessness, of course, dun sa affected part, kaya need mo lagi assess yung distal area. And then lastly, poikilothermia, o pag makikita mo na cyanotic and cool to touch. Lastly, ang management na sa compartment syndrome, may tinatawag tayo na cast readjustment. Yung cast readjustment natin, meron siyang tinatawag na bivalving, pwede rin petaling, or widowing. So, yan. Again, ang management ng compartment syndrome ay i-readjust mo siya. So, cast readjustment, bivalving, widowing, and petaling. Again, bivalving, widowing, and petaling, yun yung mga cast adjustments na management for compartment syndrome. So, kapag hindi yun nag-work, yung cast readjustment, we should call or we should report it to the healthcare provider. Second complication ng cast as immobilizer o management ng fracture is cast syndrome. This is related to hip spica cast. So, the signs and symptoms, abdominal pain, kasi nga hip spica cast, related siya dun sa hip spica cast. So, maka-experience ka ng abdominal pain and tenderness. Also, absence of bowel sounds kasi naiipit yung intestines due to cast sa abdomen o sa hip. Para siyang din, itong compartment syndrome. Dito kasi sa hip spica cast siya. So, pag ang naiipit yung mga intestines mo o parte sa abdomen mo o sa hip, tinatawag doon ay cast syndrome. So, ang management natin, of course, cast readjustment din. Gaya kanina, ito nakalagay dito, cast readjustment dito, readjust the cast. Also, gastric decompression. And lastly, esophagoduodenostomy. Yung, kung makikita nyo, ang cast readjustment dito is basically sa abdomen o sa hip part. So, ulitin natin ang management sa cast syndrome. Cast readjustment, gastric compression, and lastly, gastroesophagoduodenostomy. Tandaan natin yung gastroesophagoduodenostomy. So, another management ng fracture is traction. Traction is used to maintain bone alignment. So, ano ba ang mga rules ng traction? First, dapat yung sandbag ay nakahang lang siya freely. So, sandbag must be hung freely. Second, merong types kasi ng fracture traction. We have skin traction, skeletal, and accessory. So, first, sa skin muna tayo. Sa skin, gumagamit lang sila ng adhesive and tapes. And we should watch out for pressure sores. Titignan natin sa skin traction kung may pressure sores. Sa skeletal traction naman, magamit ng pins and needles. So, watch out for infection. Of course, dahil sa pins and needles ang gamit. So, watch out for infections and meningitis. Management is to clean the affected part with NSS, chlorhexidine, or betadine. Again, sa skeletal traction, magamit dito ng pins and needles. So, we should watch out for infection and meningitis. So, to manage the skeletal traction, we should use NSS for cleaning and chlorhexidine and also betadine. Lastly, accessory traction. Sa accessory traction, with the word accessory, gumagamit ng brace. So, you should watch out for bone deformity. So, yung mga brace, merong Milwaukee for scoliosis, Dennis Brown, Atlanta, Shunt Scholar. So, eto. This is from INAP. So, sa skeletal traction, ayan, pin inserted to the bone, pins and needles. Sa skin naman, skin traction, they use adhesive tapes or bandages sa skin. So, ang purpose naman kasi ng skeletal is to immobilize the bone, while the purpose of skin is to relieve muscle spasm. Sayang walang picture, pero yun. Again, ang purpose ng skeletal is to immobilize. Immobilize the bone. Kapag skin, ginagamit na adhesive and tapes para lang ma-relieve yung muscle spasm mo. So, what are the example of skeletal? Halo vest, Gardner Wells, Steinman pin, Crutchfield tongue, balance suspension traction. Ang palatandaan pala kapag gusto mong malaman kung skin o skeletal traction ba yun, kapag sa skin, nagtatapos yung mga type na yon with traction. Example, ito, sa skin, may box traction, ito Russell's traction, ito Bryant's traction. So, ang except lang sa balance suspension traction kasi nandito siya sa skeletal. So, ayun. So, dito muna ulit tayo sa skeletal traction. So, dapat kapag naka-skeletal traction ka, meron kang torque wrench na available lagi sa bedside. Again, kapag skeletal o naka-skeletal traction si patient, dapat meron kang torque wrench na available sa bedside. Then, dito tayo sa skin, gumagamit ng adhesive or tapes, and ang purpose is to relieve muscle spasm. Meron tayong mga example ng skin traction. We have box traction. This is used for one bone fracture. Box is used for one bone fracture. And of course, i-check natin yung heel of the foot for bed sore. Again, sa box traction, it is used for one bone fracture lang, and we should check for the heel of the foot for bed sore. Next is Russell's traction. So ganito na lang para mas madali. Ang box, meron siyang isang S, while Russell's have 2 S. So box is used for one bone fracture, while Russell's traction is used for 2 or more bone fracture. Ayan o, marami siyang S. 2 or more bone fracture. And dito, i-check mo is the back of the knee for bed sore. Sa box traction, one fracture lang. Ang i-check mo is yung heel of the foot for bed sore. While yung Russell's traction, ginagamit siya for 2 or more fracture, bone fracture. And ang i-check mo is yung knee, back of the knee. Again, ito, heel of the foot is sa back of the knee. Yung Russell is back of the knee for bed sore. Ito namang Bryant's traction. This is commonly used sa mga children o pedia, age less than 3 years old o with 35 pounds lang. Ayan, ito example. The nurse is caring for patient with box traction. May traction. The nurse is aware that this is for the purpose of course, dahil may traction, skin traction siya. So, ano ba ang purpose ng skin traction? It is to relieve muscle spasm. See? Na-apply natin. So, proceed tayo dito sa types of fracture. First is simple o tinatawag na closed fracture. Ayan, wala namang protrusion. Ayan o, intact pa yung skin mo. Ayan, intact skin and no skin protrusion. Next is compound o open fracture. Ayan na, may skin protrusion na siya. Ayan o, hindi na intact yung skin mo eh. Nakabuka. So, compound o open fracture. So, of course, dahil open siya, prone siya sa infection. So, tatandaan natin na kapag open yung fracture o compound fracture, it is prone to infection. So, ang priority natin, of course, is to cover with a cloth. And also, to apply splint, immobilize. So, again, ulitin natin na kapag open ang fracture, open o compound fracture, of course, may skin protrusion, hindi na intact yung skin natin, prone siya sa infection. So, ang gagawin natin, dahil nga open siya, cover natin siya with cloth, and also, apply tayo ng splint to immobilize. another management, dahil nga at risk for infection, we give tetanus toxoid and apply cold compress. So, highlight natin itong tetanus toxoid. Again, we give tetanus toxoid sa patient na may open fracture o dahil na rin syempre sa infection and bukas siya eh. Next is overriding. Yan, one extremity is shorter than the other. And next is green stick. Ito common to sa mga pedya o 18 and below. Ayan, yun yung mga pedya. Ulitin ko ha, green stick is fracture with rugged edges. Tandaan nyo, ang green stick fracture ay ang fracture with rugged edges. So, one bone is bent over o cracked sa bone. So, common siya in pedya o yung mga patient na 18 and below. Comminuted fracture. Ito, may presence ng bone fragments. Ayan. Kalat. And 6 transverse. Cut straight across. Common to sa mga patient with osteomalacia. Yung osteomalacia, yun yung softening ng bone because they lack of vitamin D. Ayan o, straight. So, transverse. Again, ulitin natin green stick, yung fracture with rugged edges. Tapos, common siya sa pedya. And then, ayun. Comminuted, meron siyang bone fracture, bone fragments. And then, transverse, common siya sa patients with osteomalacia. Tandaan natin, yung transverse is common in osteomalacia patients. Dahil nga, nakaka-experience sila ng softening ng bones due to lack of vitamin D. And next is oblique. Pa-diagonal yung cut ng bone fracture nila. So, this is common sa trauma in lower extremities. Kadalasan nakikita to sa mga athletes. Also, spiral. Spiral ay na-twist na yung bone. Common to sa mga physical abuse in older female. Tatandaan natin yun. Ang green stick is pedya. Green stick ay may rugged edges. Yung spiral, common siya sa physical abuse. Spiral fractures common sa mga physical abuse sa older females. And yung transverse, yan yung straight ang hiwa, cut straight across, common in osteomalacia patients. Yun lang naman. And also, isa pa sa tatandaan natin yung compound, dahil nga open siya, may skin protrusion siya, at risk for infection. So, bibigay tayo ng tetanus toxoid bilang management. Also, ang priority natin dyan is to cover with a cloth. And pag ka-cover mo, apply splint. So, yun. Apply din ng cold compress, syempre. So, ninth na fracture is long bone fracture. Sa lahat ng bone fracture, ito ang pinakadelikado. So, dapat priority mo to. So, ang pinaka-significant na i-assess mo sa fracture kasi kung anong type ng bone ang affected. Dahil meron tayong long bone, gaya nga dito, sinabi ko long bone fracture, priority siya. So, sa long bone kasi, nagko-contain si long bone. Makikita to sa femur part ha. Si long bone, na may nagko-contain siya ng yellow marrow o fats. So, ito. So, yung yellow marrow o fats from fractured long bone, kapag na-release yung fats na yon sa blood vessel, yung platelet, mag-a-attach siya sa fats. So, didikit siya dun sa fats, magkakaroon ka ng fat embolism. Delikado na rin to. Ito palang life-threatening na. So, fat globules may also dislodge to the different organs like kidney. Apektado ang airway mo. Also brain, pwede rin sa brain. So, pag na-dislodge yung fat globules na yun galing doon sa fractured na long bone, possible na magkaroon ka ng pulmonary embolism na makikita natin may signs and symptoms of petechial o pinpoint rash sa neck and chest. Also, of course, dahil affected si lungs, airway, difficulty of breathing. Ayan. From pulmonary embolism, makaka-experience ka ng DOB, respiratory acidosis, and also decreased O2 sat. So, from there, ito na deadly. Pwede kang magkaroon ng acute respiratory failure. And also, pag na-dislodge naman si fat, hindi nga sa lungs, sa brain naman, you're at risk for ischemic stroke. So, ayan. These are the life-threatening complications of bone fracture, fat embolism, and pulmonary embolism manifestation. Of course, dyspnea due to obstruction sa blood flow and also pleuritic chest pain. Tatandaan natin yung pleuritic chest pain. And ito, petechial o pinpoint rash in neck and chest. Okay, so next na disorder o disease under musculoskeletal after fracture is Paget's disease. So, Paget's disease o ang tinatawag natin na otitis deformans. Again, ang Paget's disease ay tinatawag ding otitis deformans. So, ang problem dito may abnormal bone metabolism. So, meron tayong tinatawag na osteoclast and osteoblast. Ang magiging palatandaan mo dito, ang osteoclast, crush. Etong osteoblast, build. So, pag osteoclast, bone destruction. Kinakrush niya yung bone mo. So, osteoclast is bone destruction, while osteoblast, tandaan mo dito dahil B siya, building. Ibi-build o i-remodel niya. Ayan. So, proceed na tayo agad sa pathophysiology. So, pag increased ang osteoclast at osteoblast mo, yung activity, increased osteoclast and osteoblast activity, it will result to joint pain o arthralgia. Ayan nga abnormal metabolism. So, pag increase yung pag-metabolize ng bone mo, increase yung destruction ng bone mo, increase din yung remodeling ng bone mo. Of course, abnormal yun, makaka-experience ka ng joint pain o arthralgia. Arthralgia na tinatawag. So, highlight lang natin. So, makaka-experience ka rin ng weakness. Of course, may pain ka na naramdaman or arthralgia, makaka-experience ka rin ng musculoskeletal weakness. Yan, hindi lang joint pain, kundi bone pain din. Joint pain is arthralgia, also bone pain, and muscle weakness, and also, meron kang bone deformity. Kasi nga, dinedestroy mo, tapos nire-remodel mo rin. Diba? Parang anggulo. May abnormal bone metabolism. So, ang mangyayari sa'yo, dito, yung hallmark sa inyo na mosaic-like appearance. Ganito siya. Para kang lion face. Ayan, skull bone. Ayan, yung tibia mo, eto siya. Imbis na straight siya, may bowing. Parang sa ano lang din yan, osteomalacia. Ayan, cochlear degeneration. Ayan. To, big lions have heart failure. So, kasi, dahil nga lion face, ang mga taong may Paget's disease. Tandaan nyo na, pag Paget, pangit. So, mukha silang, yun nga yung mosaic-like appearance. So, ayan, tatandaan natin to. Big lions have heart failure. So, big yung B stands for bone pain. I, increased bone density. G, giant osteoclasts. Itong L, big lions nga eh. L, lion face o mosaic-like appearance. Ayan. Increased alphos. Ito, hindi naman na siya important, pero sige, dami na natin siya. Osteolytic o sclerotic. Pag nakita mo sa x-ray, may nerve compression din, and saber-shin o saber-shin. Yan yung bowing of legs. Yan, sa tibia bowing. Tibia bowing. Of course, big lions have heart failure. H stands for hearing loss. Dahil nga may cochlear degeneration. And lastly, may heart failure din dahil high ang output. Litin natin. Paget's disease o tinatawag na otitis deformans, yun ang abnormal bone metabolism. So, increase yung bone metabolism niya. Increase yung osteoclast, which is the bone crushing or bone destruction. Increase din ng osteoblast o bone building o bone remodeling. So, pag increase yon, of course, abnormal, nakaka-experience si patient ng joint pain o arthralgia, nakaka-experience din si patient ng bone pain, joint pain, kanya kasi joint pain o arthralgia, and also bone pain, experience din ng musculoskeletal weakness, and also kakaroon ng bone deformity. Under bone deformity, ang makikita mo kay patient ay may mosaic-like appearance sila. So, ayan, ulitin din natin to. So, ayan, may skull bone thickening. Nagtitikan yung skull bone nila o lion face sila. Also, may cochlear degeneration. May tibia bowing din sila o saber-shin. So, also, ang di lang natin na masyado na emphasize is yung heart failure. Nagkakaroon din sila ng heart failure dahil increase yung output. Hearing loss due to cochlear degeneration, lion face, increased alphos, osteolytic or sclerotic sa x-ray, may nerve compression, saber skin o tibia bowing na tinatawag. Ayan, big lions have heart failure. So, ano nga bang management natin dito sa Paget's disease? Of course, bawal na bawal ka mag-cold compress dahil pag kinold compress mo, yung nafe-feel mo agad siya, like parang naninigas, maka-experience ka ng bone pain. So, no to cold compress sa Paget's disease. Tatandaan na no to cold compress sa Paget's disease dahil it will cause you bone pain. Ang drug of choice natin dito is biphosphate alendronate o Fosamax. Again, ang drug of choice sa Paget's disease ay biphosphate alendronate Fosamax. This is to control or normalize the osteoclast activity of the bone. Again, tatandaan na bawal ang cold compress sa Paget's disease, and the drug of choice is biphosphate alendronate o Fosamax. Complication, ito common siya na lumalabas complications sa Paget's disease is invagination of the skull of platybacia. Ito nga, nakikita natin yung may skull bone thickening o tinatawag nila na lion face. And invagination of the skull o platybacia. So, dahil nga parang nagtitikan siya, nag-i-increase yung ICP natin. And kapag, syempre, nag-increase yung ICP, tuloy-tuloy na yan, may respiratory depression. Makaka-experience si patient ng respiratory depression and acute respiratory failure. Threatening? Yes, life-threatening. So, kapag naka-experience na ng respiratory depression, na-assess mo na decrease yung RR, report na kay healthcare provider. So, tatandaan natin, yung brain natin, wala na siyang room for space. Like, kung ano lang siya, enough na yun. So, kapag kapag si patient, naka-experience na ng thickening ng skull, o di kaya, nagkaroon ng invagination of the skull, o tinatawag na platybacia. Bitin ko invagination ng skull. Pag yan, karoon ng platybacia, mag-i-increase yung intracranial pressure mo. Alam mo naman, na kapag nag-increase yung intracranial pressure mo, i-increase din ang RR mo, and worst, magkakaroon ka ng respiratory depression which can lead to acute respiratory failure. And syempre, ang management mo dyan, of course, to report to the healthcare provider. Okay, so the next topic is arthritis, or what we call the inflammation of the joint. So, ang cause ng arthritis, para mas madali, we have the word AHOB. AHOB. A stands for autoimmune. H stands for hereditary. O stands for overweight or obesity, kung ano man tawagin nyo, pero overweight. B stands for bad diet, and last I stands for infection. So, tatandaan natin na ang cause ng rheumatoid arthritis ay AH, from AHOB, autoimmune and hereditary. So, tatandaan natin ng rheumatoid arthritis is autoimmune and hereditary. Next, the osteoarthritis. Ang osteoarthritis natin, ang cause nun ay hereditary and overweight. Again, ang osteoarthritis, ang cause ng osteoarthritis ay hereditary and overweight. So, next is gouty arthritis. So, para makuha natin siya, okay, ROGS, AHOB and ROGS. So, tagdadalawa yan, and sa last, of course, yun yung infection. Solo lang ng septic arthritis yan. So, AHOB and ROGS. So, isulat natin ang ROGS. Sulat ko pa ba? Ayan, ROGS. R stands for rheumatoid. So, ang cause ng rheumatoid, of course, autoimmune and hereditary. So, ang osteoarthritis naman, hereditary and overweight. Ang gouty arthritis naman, overweight and bad diet. And lastly, ang septic, of course, solo niya ang eye infection. Kapag septic arthritis, infection na yan. Just like the septic shock. So, sulat natin muna. Ayan. Rogs, and Ahobi. Yun lang naman yung tatandaan natin dyan. Okay, so proceed na tayo. So, what are the diagnostic tests to diagnose the patient na may arthritis? First, of course, di mawawala sa musculoskeletal ang röntgenogram o tinatawag nating x-ray. Pangalawa, ang atrocentesis. Ang ginagawa sa atrocentesis, nag-a-aspirate ng synovial fluid. Ano ba ang synovial fluid? Ang synovial fluid, ang ginagamit ng body natin to lubricate the joint and to cushion the joint. So, i-aspirate yung synovial fluid para ma-detect if ang patient ay may rheumatoid o septic arthritis. Again, indicated si atrocentesis para ma-verify if the patient have rheumatoid or septic arthritis. Next is ESR o erythrocyte sedimentation rate. It is indicated for rheumatoid arthritis again. And lastly, C-reactive protein na indicated also for rheumatoid arthritis. Pero pinakatatandaan natin si atrocentesis. Dito nag-aspirate ng synovial fluid. Yung synovial fluid, ginagamit siya to lubricate the joint o to cushion the joint. So, pag na-aspirate yun, mabe-verify mo if the patient have rheumatoid or septic arthritis. So, proceed na tayo sa types of arthritis. First is yung rheumatoid arthritis. So, balik tayo sa ROGS. Yung R stands for rheumatoid. So, ang partner niya is AH. Ang cause ng rheumatoid arthritis is autoimmune and hereditary. Ayan. So, may signs and symptoms na mafe-feel mo kapag ikaw ay may rheumatoid arthritis. What are those? Of course, yung morning stiffness. Tatandaan natin na ang patient na may rheumatoid arthritis ay nakakaranas ng morning joint stiffness, specifically sa ang joint sa shoulder natin na tumatagal ng 30 minutes. Again, nakakaranas sila ng morning joint stiffness, specific joint is sa shoulder na tumatagal for 30 o more than 30 minutes. Next is meron din silang joint deformity. Kung makikita nyo, ito, sa finger nila, yan ang tinatawag na swan neck finger. So, yun ang joint deformity nila, yung joint nila sa finger. So, yan, swan neck finger. And next, nakaka-experience din sila ng fever. So, ayun. Itin natin, signs and symptoms ng rheumatoid arthritis ay meron silang morning stiffness o joint stiffness, specifically sa shoulder na tumatagal ng more than 30 minutes. Sunod, meron silang joint deformity. Isa sa joint deformity nila ay yung tinatawag na swan neck finger o yung swan neck deformity. Ito siya. And lastly, nakaka-experience sila ng fever. So, ano nga ba yung mga risk factors? At risk ka for rheumatoid arthritis kung ikaw ay female. At risk ka din, of course, kapag meron sa pamilya nyo kasi nga hereditary to, so genetic. Another is kapag mahilig ka mag-smoke. And lastly, old age. Kaya mapapansin nyo, merong mga may patient na, yan nga, old age. Kadalas sa kanila may ganito sila. Ayan. So, ulitin natin, ang risk factors na rheumatoid arthritis, of course, old age, genetic, kasi hereditary nga siya, smoking, and also kapag ikaw ay babae. So, common ang rheumatoid arthritis sa mga babae. Ano ang complication ng rheumatoid arthritis? Meron tayong tinatawag na Volkmann contractures. Ito yun. Kapag nakita mo na yan, report mo na agad kay HCP o kay healthcare provider. Volkmann contractures is due to decreased blood flow sa affected extremities. Again, ito ang tatandaan natin yan kasi minsan hindi binabanggit si Volkmann contractures kapag meron ng decreased blood flow sa affected extremities, automatically report mo na kay HCP kasi circulation yun, so priority siya. Ang tawag doon sa decreased blood flow sa affected extremities ay Volkmann contractures. So, ang management for rheumatoid arthritis, ang priority natin, of course, pain meds. Kasi nga, may pain sila na nafe-feel. Yang stiffness na yan, morning stiffness o joint, specifically sa shoulder, na tumatagal ng 30 minutes yan, pain din yan. So, priority natin kay rheumatoid arthritis is pain. Parang sabi nila na kapag sa musculo, priority talaga ang pain. So, ang mga pwede nating pain meds na magamit ay yung COX-2 inhibitor. Ito yung mga celecoxib, yung mga coxib. Kaya nga COX-2 inhibitor. So, coxib, etoricoxib, arcoxia, also NSAIDs, and morphine kapag sobra na talaga. Kasi potent itong morphine. Pero, i-monitor natin dito kung sakaling ito ang magagamit, i-monitor natin yung respiratory depression, and may antidote naman ito na Narcan and Naloxone. Next, another management is warm compress and also warm shower. Also, firm dapat ang mattress, and isa sa mga management is yung gold salts. Ang signs and symptoms nga lang niya ay rash and pruritus. Yan, tatandaan natin yan, gold salts. Pero meron tayo tinatawag na gold standard as management sa rheumatoid arthritis. We have the DMARDs. So, yung isa sa mga DMARDs na ginagamit, ang DMARDs kasi, I forgot kung ano yung yung parang full na ano niyan, pero yung DMARDs na lang. Okay, search. Disease-modifying anti-rheumatic drug. So, yan. Yan ang meaning ng DMARDs. So, disease-modifying anti-rheumatic drugs. So, merong kilalang DMARDs na ginagamit sa rheumatoid arthritis. What are those? We have methotrexate. Pero, ang methotrexate, tatandaan natin na kapag ikaw ay naka-methotrexate, dahil nga ito ay immunosuppressant, you're at risk for infection. Also, photosensitivity din, and teratogenic siya. It means contraindicated siya sa buntis. So, kapag buntis ka, you're not allowed to take methotrexate. And lastly, it decreases the vitamin B9 o folic acid, which helps for RBC maturation. Kaya, mag-iingat talaga tayo sa methotrexate. So, again, yung methotrexate, immunosuppressant siya. So, at risk ka for infection, photosensitivity din to, and then teratogenic, so contraindicated sa buntis, and it decreases your vitamin B9 o folic acid, which helps for your RBC maturation. Another DMARDs na ginagamit for rheumatoid arthritis is TNF or tumor necrosis factor inhibitor. Ito yung mga MUMAB. Pero, kailangan natin i-watch out for Cox disease o TB. Again, kapag ikaw ay nag-take ng tumor necrosis factor inhibitor o yung mga MUMAB for rheumatoid arthritis, kailangan mong tignan o i-watch out si patient for Cox disease o TB. And also, yung mga DMARDs, yan, gaya ng methotrexate o yung mga MUMAB, yung mga TNF, they are hepatotoxic. So, kailangan mong i-check din o i-monitor for liver function test. Another management. So, kapag ang cause is autoimmune, of course, ang automatically management for autoimmune is corticosteroids. Another is etanercept as sub-Q injection. Okay, so next is osteoarthritis. So, ang cause ng osteoarthritis is pag overweight si patient and hereditary. So, namamana ito. Risk factors. So, maging at risk ka kay osteoarthritis kapag ikaw ay, of course, overweight, obese. And also, hereditary nga. So, genetics. And then, smoke. And, of course, common ito sa male. Unlike dito, ang rheumatoid kasi, common siya sa female. Almost same lang naman. Ang pinagkaibahan dito kasi sa rheumatoid, common siya sa old age eh. And, yun lang naman. And, female. So, dito kasi kay osteo, common siya sa male. Male and obesity. So, yun yung kaibahan lang nilang dalawa. Due to obesity, yun naman ito. Obesity or overweight. So, ang signs and symptoms ng osteoarthritis are si patient nakaka-experience siya ng joint pain, pero it can be relieved by rest. So, joint pain that can be relieved by rest. So, yun yung kaibahan niya sa iba. Ito, nadadaan naman sa pahinga. So, also, meron din siyang nodes sa kanyang finger. So, makikita nyo dito, ito ang Heberdens and Bouchard. So, palatandaan, pag high, Heberdens sa taas. Kapag low or below, Bouchards. Yan. So, ano nga bang management natin for osteoarthritis? Of course, dahil nga isa sa risk factors niya ay obesity or overweight, i-advise natin o i-educate natin si patient to go on weight reduction o exercise, to also diet modification. Isa din sa dapat i-avoid ni patient ay ang paglalagay ng pillow sa ilalim ng ulo, ng likod, at ng tuhod. So, no pillows under the head, the back, and the knee para ma-avoid yung contractures. And pangatlong management, warm compress. Also, to wear tennis shoes kasi ang mga tennis shoes ay stable yung heel nila and wide yung base. So, tatandaan natin na kapag osteoarthritis, sa management niya is to wear tennis shoes dahil stable ang heel and wide yung base. Ang priority, of course, dito sa osteoarthritis, which is priority naman sa lahat ng musculoskeletal, is yung pain meds. So, priority natin is pain management. Ano ba yung mga pain meds? COX-2, NSAIDs, and morphine. Meron din tayong binibigay na herbal med o yung pwedeng herbal med for osteoarthritis, which is yung glucosamine. So, okay, summarize natin. Ang osteoarthritis is due to hereditary and overweight. So, ang risk factors niya, pag ikaw ay smoker, obese, male, common siya sa male, and then genetics. So, ang signs and symptoms ng osteoarthritis ay joint pain but can be relieved by rest. Also, may nodes din sila, ang Heberdens and Bouchard nodes. So, ang management natin dito, of course, dahil sila ay overweight, in-advise sila to do weight reduction and diet modification. So, mag-exercise and ayusin yung diet nila. Next is no pillow under the head, the back, and the knee para ma-avoid yung contractures. Also, pangatlo, warm compress. And then, pang-apat, we can also advise them to wear tennis shoes kasi wide yung base niya and stable yung heel. Again, wear tennis shoes. Pang-lima, ang priority management natin sa lahat ng musculoskeletal is pain management. So, ang mga pain meds natin na pwede maibigay is yung COX-2 inhibitor, NSAIDs, and morphine. So, pwede, meron ding herbal meds for osteoarthritis. Yun ang tinatawag na glucosamine. So, done na tayo sa osteoarthritis. Okay, so another type of arthritis is gouty arthritis. Gouty arthritis, ang cause nito ay overweight and dahil meron ka rin bad diet. Yung diet mo ay high in purine o high in uric acid. So, ano ba yung mga foods that are high in uric acid o high in purine? So, meron tayong term o word na all boys. A stands for anchovies. L stands for legumes. Another L stands for lentils. So, B na tayo. B stands for beer. O stands for organ meat. And Y stands for yeast. And S stands for sardines or mga soya beans, tofu, ganon. Again, all boys, yun yung tatandaan natin. Yun yung mga foods that are high in purine o high in uric acid. Ulitin lang natin ha. Anchovies, legumes, lentils, beer, organ meats, and then yeast, at saka sardines and soya beans o yung mga tofu. So, ang risk factors ng gouty arthritis, common ito sa male, sa mga nag-smoke, genetic din ito, and also sa mga alcoholic. Kaya nga nakalagay dito yung beer. Ang cause niyan ay high in purine, high in uric acid. Ayan. So, tandaan natin. Ulitin natin. Risk factors dito ay common ito sa male, sa mga alcoholics, sa mga smoker, and also genetic. So, lipat na tayo sa pathophysiology. So, dahil sa pagkain mo na high in uric acid, yung uric acid nagtumataas yung uric acid sa joint. So, kapag nag-crystallize yun, yung uric acid na yun sa joint, magkakaroon tayo ng tophi formation. Tapos, kapag nagkaroon na ng tophi formation, syempre masakit yun dahil nga nag-crystallize siya. Tutusok-tusok yung joint mo. So, magi-inflame siya. So, common is yung sa side ng big toes, which na tinatawag natin podagra. And then, yun nga, dahil inflamed and yun na-crystallize, maka-experience din ng severe joint pain. So, ayan. Pain na naman, kaya may pain management din mamaya. So, ayan yun. Inflamed ang joint, may swelling. Pag yan, uric acid crystals. Deposits of uric acid, ito yun. Ayan. Tapos nag-crystallize. Itin natin yung pathophysiology natin. So, hindi. Tapusin ko na lang muna. So, management, meron tayong tatlong meds na common na ginagamit sa gouty arthritis. First is yung colchicine. Colchicine is for severe pain. Also indicated siya for MI. Tandaan natin na indicated din siya for MI. And may side effects to. So, ang side effects ng colchicine ay diarrhea. Another is allopurinol. This is to prevent the crystallization of uric acid. And last, probenecid. This is a uric acid diuretic. So, ulitin natin. Merong drug of choice for gouty arthritis. First is yung colchicine. Colchicine is for severe pain na ginagamit din kadalasan for MI. Ang side effects niya ay severe diarrhea, not severe, but diarrhea lang. So, ang side effects ng colchicine is diarrhea. Another is allopurinol. This is to prevent the crystallization of uric acid. And lastly is probenecid. Probenecid is uric acid diuretic. So, laging tatandaan na all gouty meds are nephrotoxic. So, toxic siya sa kidney. So, anong gagawin? Increase ang oral fluid intake. Okay, so summarize natin. So, gouty arthritis, ang cause niya ay high purine, high uric acid diet. Yun yung mga bad diet natin. And also, overweight. So, ang risk factors, so ano nga ba yung mga high uric acid o high in purine natin na food? Meron tayong word na ginagamit na all boys. A stands for anchovies, L for lentils, L for legumes, B for beer, O for organ meats, Y for yeast, and lastly S for sardines o soya beans o yung mga tofu. So, ang risk factors ng gouty arthritis, of course, kapag ikaw ay manginginom beer, yan, alcoholic, smoker, genetic din ito, and also, kapag ikaw ay lalaki. So, common ito sa mga lalaki, common sa male. So, balik tayo sa pathophysiology. So, yung mga foods high in uric acid, yan ng all boys, dahil increase ang uric acid mo, mag-increase yung uric acid mo sa joint. So, pag nag-increase yung uric acid mo sa joint, mag-crystallize yun sa joint mismo, mag-crystallize yung uric acid sa joint, and then, magkakaroon ng tophi formation. So, yung tophi formation, yun ang tinatawag na deposits ng uric acid. So, pag nagkaroon ng tophi formation, magi-inflamed yung side ng big toes o ang tinatawag natin na podagra. Tandaan natin na inflammation of the side of big toes is podagra. So, kapag nag-inflamed yun, of course, maka-experience si patient ng severe joint pain. Kaya, isa sa mga management ng gouty arthritis ay yung colchicine. Yung colchicine is for severe pain and kadalasan ginagamit din siya o indicated for MI o myocardial infarction. Ang side effects ng colchicine ay diarrhea. Next, another drug na ginagamit for gouty arthritis is yung allopurinol. Allopurinol is to prevent the crystallization of uric acid. And lastly, probenecid. Probenecid is a uric acid diuretic. So, tatandaan natin na ang mga meds na yon o mga gouty meds like colchicine, allopurinol, and probenecid, they are nephrotoxic. Toxic siya sa kidney. So, ang gagawin to manage that, we should increase our oral fluid intake. Okay, last type of arthritis is septic arthritis. Ang cause ng septic arthritis ay inflammation and infection. So, signs and symptoms ng septic arthritis, automatic na yon. Fever and sore throat kasi nga may infection. Also, joint pain. Parang di naman nawawala si joint pain sa sa arthritis. And also, body malaise. Dahil nga may fever ka, so, makaka-experience ka talaga ng body malaise. So, and also, warm to touch yung affected area. So, ang management natin for septic arthritis, ang management for all musculoskeletal disorders, of course, priority ang pain meds. Yun yung mga COX-2 inhibitor, NSAIDs, and then morphine. Next is antibiotic. Antibiotic dahil nga may infection si patient. Ano yung mga ginagamit na antibiotic? Nabanggit ko na rin ito. We use aminoglycosides. Yun yung mga mycin. Mycins are nephrotoxic. Toxic sa kidney, toxic din sa tenga. So, nakaka-experience ka ng, yun nga, ototoxic. So, possible na maka-experience ng tinnitus, nephrotoxic, and also hepatotoxic. So, dapat i-check mo yung liver function test. Ayun. So, kapag ganon, report na kay healthcare provider. Also, kapag may fever and sore throat or infection, isa sa management talaga ay ang fluid. So, fluid of choice is isotonic. Kapag wala isotonic, ay hypotonic. By the way, gaya dito sa osteomyelitis, itis, it means may infection. Ayan, infection in the bone. So, yan, fever, sore throat, bone pain. So, ang management dyan, gaya ng sinabi ko kanina, is antibiotic. Kasi yun naman talaga ang management for infection. So, antibiotic. Ang antibiotic is aminoglycosides. And yun yung mga nag-end with mycin. So, they are ototoxic. So, may tinnitus, nephrotoxic. So, dapat i-check mo yung urine output. And lastly, hepatotoxic. So, check mo yung liver function test. So, same lang siya. Osteomyelitis and then yung septic arthritis. Ayan, kung makikita nyo. Magamit din ng aminoglycosides kasi this is infection. Ayan, infection. Okay, so proceed na tayo kay osteomalacia. Osteomalacia is softening of the bone. So, may problem tayo sa vitamin D o calciferol. So, meron kasi tayo tatawag na vitamin addict. So, side notes lang, vitamin A is for eye. So, retinol siya. So, kapag decrease ang vitamin A natin, naka-experience ng blurring of vision. Vitamin D, calciferol, of course, this is for bone. So, may osteomalacia o sa adults and rickets kapag sa bata. So, same lang naman ang meaning yun. Iba lang ng term kapag adult and pedia. Next is vitamin E o tocopherol. This is for skin. So, mga skin problem. And lastly, vitamin K. This is aquamephyton. So, this is for bleeding. So, balik tayo. Osteomalacia. So, softening ng bone. May problem ka sa vitamin D mo o sa calciferol. So, sa adult, tinatawag siyang osteomalacia. Pero kapag pedia ka o bata, ang tawag dyan rickets. Ang mapapansin mo, so, sa cause muna tayo. Ang cause, of course, vitamin D deficiency, mababa ang vitamin D mo. And also, malnutrition. Again, ang cause ng osteomalacia ay vitamin D deficiency and malnutrition. So, signs and symptoms, softening of the bone, bone pain, weak din ang bone mo dahil nga nagsusoften yung bone mo. So, weak siya. And then, may pain kang na-experience sa bone. So, at risk ka for bone fracture. So, tatandaan lang natin na yung osteomalacia is softening ng bone. Tapos, isipin natin, kapag soften yung bone, of course, it's weak. Risk ka for fracture. May pain. Yun. So, ang hallmark sign niya ay eto, bowing of legs. Ayan. Bowing of legs. So, ang management natin dito, of course, dahil nga may vitamin D deficiency ka, ang dapat na diet mo is vitamin D rich foods. So, we have the word BECO. B stands for bread, E stands for egg, C stands for cereal, and O stands for oat. Again, ang mga meron tayong BECO as word na pwede natin tandaan para sa kumbaga maka-help siya para mapataas yung vitamin D mo kasi may vitamin D deficiency nga tayo sa osteomalacia. So, yung mga food na yan ay bread, egg, cereal, and oat. Yan yung mga vitamin D rich foods natin. Also, calcium supplement. Of course, helpful to sa bone. And pang third, exposure then to good sunlight. Diba? Minsan nagpapaaraw tayo para sa vitamin D. Yon. So, meron kasing healthy pa na sunlight. Meron din bad sunlight. So, ang bad sunlight starts at 10 a.m. to 3 p.m. And lastly, assist natin sila with ADL dahil nga so weak yung bones nila. So, assist natin sila with activities of daily living. So, summarization. So, osteomalacia is softening of bone. So, mayroon sila dito ang vitamin D deficiency. Ang osteomalacia, ang term for adult, and rickets naman ang term for pedia. So, signs and symptoms kapag may osteomalacia, of course, dahil nga sinasabi natin na softening yung bone nila weak. Naka-experience sila ng bone pain. And also, at risk sila for fracture. Ang hallmark sign ng osteomalacia o ng rickets kung sa pedia ay bowing of legs. And ang management natin dito, of course, we have to consume vitamin D rich foods. Meron tayong word na BECO. B stands for bread, E stands for egg, C stands for cereals, and O stands for oats. Also, isa sa management natin dito is to take calcium supplement para makatulong sa pagpapatibay ng bone. And then, next is exposure to sunlight. Kasi nga, sa sunlight, may nakukuha tayong vitamin D, di ba, pag nagpapaaraw. So, ang vitamin D na yon sa sunlight ba? Sa sunlight, meron tayong bad sunlight. So, hindi porket may sunlight, magpapaaraw ka na ng magpapaaraw. So, kapag oras na ng bad sunlight, syempre, tago ka na. So, ang bad sunlight, lumalabas ng 10 a.m. to 3 p.m. And lastly, assistin natin sila sa ADLs dahil weak ang kanilang bone. So, assist natin sila sa activities of daily living. So, next is carpal tunnel syndrome. Carpal tunnel syndrome, this is the compression of the median nerve. Tatandaan natin, compression of median nerve due to increased fluid level in the body that leads to edema. So, yan. Ang cause niyan, yan, edema, yung increased fluid level na may edema, naiipit na yung median nerve mo, so nagko-compress siya. Ayan. Ulitin ko lang, compression of median nerve due to increased fluid level in the body that leads to edema. So, ano yung mga apektado sa median nerve? Ito yung index finger, thumb, and middle finger. So, makikita nyo mamaya yung papal sign. Index finger, thumb, and middle finger. So, ayan, dito makikita nyo naman, median nerve is compressed at the wrist, resulting in numbness or pain. Kaya, ayan, makikita nyo naman numbness or pain. So, makikita natin yan sa signs and symptoms. So, what are the signs and symptoms of carpal tunnel syndrome? Of course, patient will experience paralysis. And sinabi na nga dito na may numbness, naka-experience si patient ng paresthesia, numbness, tingling sensation, funny feeling, pins and needles. Ayan yung mga tatata natin sa paresthesia. And also, inflammation then. And lastly, pain on the 3 fingers. Yung 3 fingers na nabanggit, index finger, thumb, and middle finger. Risk factors nito is repetitive movements, yung mga paulit-ulit na gawain. Yung mga prone dito ay mga nurses, secretary, baker, pianist. Ayan. Hindi lang naman yan lang, marami pa. Pero yan yung sa kanila common yun. Also, using of canes, yan, kasi naiipit yung median nerve natin, nakukompress siya. Also sa mga pregnant and sa patient with arthritis. So, ang diagnostic test natin dito kay carpal tunnel syndrome is mayroon tayong tinatawag na Fallen's test. So, naka-experience tayo ng pain kapag may acute flexion. Ayan, no? Finaflex. And then, makaka-experience ka ng pain dito kung ito yung affected. Kung ito yung meron kang pain, yung dito yung affected area mo. So, may pain ka dyan. Ayan, Fallen. Yung acute pain during acute flexion. And then, Tinel's test. Ito naman yung shock-like sensation upon palpation. Ayan, dito mo ipapalpate, dito sa median nerve. And then, makaka-experience ka ng shock-like sensation. Ang hallmark sign niya ay papal sign o yung Pope sign. Kung mapapansin nyo, ito yun, yung mga affected, nakaganyan. Ang management dito, of course, priority is pain meds dahil masakit na masakit ito. COX-2 inhibitor, NSAIDs, and morphine, yan yung mga common pain meds sa musculoskeletal. And also, bibigay din tayo ng vitamin B complex dahil affected ang nerve natin. So, this vitamin B complex is good for nerve health regulation. Surgical management natin, of course, yung release, endoscopic release of carpal tunnel syndrome or ERCTS. Post-op management, bawal ka magbuhat ng mga mabibigat. Okay, so summarization, carpal tunnel syndrome. So, carpal tunnel syndrome is a compression of median nerve due to increased fluid level in the body that leads to edema. Yun, naiipit siya. So, ano yung mga fingers na affected dito? The index finger, thumb, and then the middle finger. So, what are the signs and symptoms? Mayroon kang, si patient ay nakaka-experience ng paralysis, paresthesia, yung numbness, yan, numbness, funny feeling, tingling sensation, pins and needles, and then also, pain sa 3 fingers, yung nabanggit kong fingers, and lastly, inflammation. Ang risk factors na to ay yung mga repetitive movement. So, kapag ulit-ulit, parang nasasanay siya, naiipit. Common to sa mga nagtatype, mga nagki-keyboard, ayan, nurses, secretary, baker, pianist, ayan, yung mga repetitive movements. And also, sa paggamit ng canes, use of canes, sa mga pregnant and also sa mga patient with arthritis. So, ang diagnostic test dito, may tinatawag tayong Fallen's test o pain during, so kapag naka-experience ka ng pain during acute flexion, you're positive or diagnosed ka for carpal tunnel syndrome. So, ito yon. And also, the Tinel sign o Tinel, tinel test. Yun yung pain kapag, o di kaya shock-like sensation kapag pinalpate yung median nerve mo o sa part ng wrist mo. Ayan. So, the hallmark sign of carpal tunnel syndrome is papal sign. And then, next, for the management, of course, the priority, dahil masakit ito, pain meds. Pain meds are, na pwede gamitin are COX-2 inhibitor, NSAIDs, and morphine. And also, we also use vitamin B complex dahil vitamin B complex is good for nerve health regulation. And for the surgical management ng carpal tunnel syndrome, we have the endoscopic release of carpal tunnel syndrome or ERCTS. So, kapag tapos ng surgery, you're not allowed to lift heavy objects. So, no heavy weight lifting. Okay, so osteoporosis. Osteoporosis is a metabolic disorder that affects the bone density. So, yung bone density natin, yun yung responsible for the covering of the bone. So, again, it is a metabolic disorder that affects the bone density. So, ano nga ba yung risk factor ng osteoporosis? So, meron tayong word na osteoporosis. So, O stands for old age. So, common siya sa old age. S for smoking and alcohol, yung mga bisyo. T for trauma. E for endocrine problem. Yung endocrine problems like Cushing's disease, hyperthyroidism, ayun. So, next is O for obvious family history. Yan, yung mga family history kasi namamana din siya. P for pregnancy and O for oophorectomy dahil decrease ang estrogen. Kaya, ayun, prone ka or at risk ka for osteoporosis. Highlight natin tong oophorectomy. And then next is race. Of course, common siya sa mga Asian and then African. Next, for O, over intake of caffeine and alcohol. And S for small thin body frame. So, it means gaya yan sa mga Asian race. So, next is inadequate calcium intake. Yan. Siyempre, important talaga yung calcium sa bone. And then, lastly is meron pa palang last. So, S for sedentary lifestyle. Kapag di ka pala exercise, puro ka lang higa, ganun. And also, long-term use of corticosteroids and also menopausal. Ayan. Patandaan natin kapag mababa yung kapag decrease yung estrogen natin, prone tayo or at least tayo for osteoporosis. Kailan ba nagiging mababa yung estrogen? Kapag menopausal, kapag oophorectomy and also pregnancy. And also long-term use of corticosteroids. Tandaan din natin yan. And menopausal. The signs and symptoms are break. So, the word break, so hati-hatiin natin siya. So, B stands for bone pain, R for reduced height, E for easily fracture dahil brittle ang bone nila. And then, wait lang, ayusin ko lang to. And then, A for always fall kasi weak ang bone. And then, K for kyphosis o yung dowager hump sa likod. Yan, yung mga malalaki likod. Ulitin natin, may bone pain sila uh, reduce yung height. They fall so easily kasi weak ang bone nila. They always easily fracture, brittle dahil brittle ang bone. Also, weak bones, and then kyphosis. So, to diagnose osteoporosis, of course, di mawawala ang röntgenogram or x-ray. And most important is yung DEXA or yung dual energy x-ray absorptiometry. Ulitin natin, DEXA stands for dual energy x-ray absorptiometry. So, yung DEXA is used to measure the bone density. So, bone density, specifically talaga siya for osteoporosis. Dahil may metabolic disorder din tayo, yun nga, metabolic disorder that affects the bone density. And also, hindi na need ng consent dito. Kasi, hindi naman siya invasive procedure. So, x-ray lang din siya. Bali, parang raw röntgenogram. So, no need for consent dahil hindi siya invasive procedure. So, dapat hindi ka rin pwede mag-take ng calcium supplement prior o 24 to 48 hours prior to procedure. So, bawal ka ng calcium supplement or anything na rich in calcium before o 1 to 2 days prior to procedure. Dito natin ang diagnostic test for osteoporosis is röntgenogram and DEXA. DEXA stands for dual energy x-ray absorptiometry. It is used to measure the bone density. So, in DEXA, hindi na kailangan ng consent dahil it is non-invasive procedure naman. And then, bawal ka mag-take ng calcium supplement 1 to 2 days prior to procedure. O di ka 24 to 48 hours. Kinonvert ko lang sa hours prior to procedure. So, for the management, of course, diet modification. Dapat yung food natin is high in calcium. Kasi yung calcium nga is good for the bone. So, ano ba yung mga foods that are high in calcium? Green leafy vegetables, dairies, tofu, cereal, oats, bread, ayan, fish with fine bones, turnip o yung singkamas, and then egg. Ito ang highlight natin. So, tatandaan natin, fish with fine bones and turnip, they are good for osteoporosis. Tingnan natin. So, dapat ang diet natin is food rich in calcium. What are those? Green leafy vegetable, egg, dairies, tofu, cereal, oats and bread, fish with fine bones, and turnip. So, dapat din tayo ay mag-exercise. It can be high impact or low impact. Anything. So, meron din tayo medications for osteoporosis. Ang meds natin doon, of course, yung mga calcium supplements. Kailangan natin i-increase yung calcium sa bone. And also, calcitonin. Calcitonin bring back calcium from blood to bone. So, yun. Meron din kasi tinatawag na parang parathyroid hormone. Yun ang kabaliktaran ng calcitonin. Yung calcitonin kasi, it bring back the calcium from blood to bone. Yung parathyroid hormone kasi, it pulls calcium from bone to blood. So, one drug of choice, of course, the biphosphonate alendronate fosamax. And also the risedronate. Yan, basta dronate, ayan, biphosphonate, alendronate, fosamax, and risedronate. Ayan yung drug of choice natin for osteoporosis. Damay na rin natin yung calcitonin and calcium supplement. So, yan. Sa biphosphonate, alendronate, and risedronate, it should be 1 tab before breakfast. Tatandaan natin na it should be before ka mag-umagahan. Pangalawa, it should be paired with 1 full glass of water. Pangatlo, after uminom, i-place mo si patient into upright or high Fowler's or neutral position. 30 minutes to 1 hour after mo magbigay ng drug. And also document. Same administration lang din siya with Lasix of furosemide. Bali, wala naman connect si Lasix, pero if you want to know yung kung paano i-administer si Lasix, ganyan siya. Bali, ulitin natin, should be taken before breakfast, 1 tab only before breakfast. Should be taken with 1 full glass of water, and then after mo pa inumin, i-place mo si client into high Fowler's o neutral position, yung upright position, 30 minutes to 1 hour after giving the drug. And then document. So, lagay lang natin, so i-ano lang natin dito yung kung paano yung mechanism of action ni biphosphonate and alendronate. So biphosphonate alendronate is a phosphate binder. So, tatandaan natin na calcium and phosphorus is or are inversely proportional. So, this drug inhibit the absorption of phosphorus in the intestine. So, pag decrease yung, dahil nga ini-inhibit niya yung absorption dun sa intestine, decrease yung phosphorus sa blood. So, kapag decrease yung phosphorus, nag-i-increase naman si calcium sa blood. So, then, kapag nag-increase na si calcium, pwede mo na ibigay si calcitonin kasi yung calcium sa blood, kukunin nyo ni calcitonin para dalhin sa bone. So, yun. So, dito naman sa pathophysiology. So, adrenal cortex, under nun is a glucocorticoids and mineralocorticoids. So, di na natin i-emphasize pa si mineralocorticoids dahil hindi naman siya ganun ka-important. So, under glucocorticoids is cortisol. So, under cortisol is meron tayong stress hormone and glucose metabolism. So, kapag high si glucose sa blood, na-alter niya si glucose sa bone. So, magkakaroon ng bone problem. Pwede magkaroon si patient ng osteoporosis and osteomalacia. And kapag nangyari yon, magiging at risk ka for fracture. So, yun lang. Bali, ulitin natin, summarization ng osteoporosis. Osteoporosis is a metabolic disorder that affects the bone density. So, ang bone density is the covering of the bone. So, ano ba yung risk factors? Of course, kapag old age, smoking, yan yung, and alcohol, yung mga mabibisyo ka, trauma, endocrine problems like Cushing's disease and hyperthyroidism, sa family history, and also yung kapag low yung o decrease yung estrogen mo in situations like pregnancy, menopausal, and oophorectomy. Also sa race, common siya sa Asian and African, yun, over intake of caffeine and alcohol, and then small thin body frame. And also at risk ka rin kapag inadequate yung calcium intake mo, kaya i-increase natin yung calcium intake natin. So, at risk ka rin kapag sedentarian lifestyle mo, and also lastly, long-term use of corticosteroids. Signs and symptoms dito ay we have the word break. So, B stands for bone pain. R stands for reduce height. Hindi kasi pantay. So, reduce ang height mo. E stands for easily fracture dahil brittle ang bone mo. A stands for always fall, o dahil kasi weak ang bone mo. And then K stands for kyphosis, o dowager hump. So, ang diagnostic test natin for osteoporosis is lagi naman Roentgenogram. And then also, pangalawa is DEXA. DEXA stands for Dual Energy X-ray Absorptiometry. It is used to measure the bone density. Malalaman dito yung bone density mo. So, hindi na kailangan ng consent dahil hindi naman siya invasive procedure, and bawal ka uminom o mag-take ng calcium supplement 1 to 2 days o 24 to 48 hours prior to procedure. So, ang management natin dito, of course, is to increase the calcium sa bone. So, increase natin yung, dapat yung calcium intake natin na food is yung mga green leafy vegetables, egg, dairies, tofu, cereal, oats, bread. Tapos, tatandaan natin, fish with fine bones, and then turnip o singkamas. Again, tandaan natin yung fish with fine bones, and then turnip o singkamas. Also, we advise them to do exercise, mapa-high o low impact man. And lastly, sa meds naman. So, sa meds, of course, calcium supplement and calcitonin. Yung calcitonin, they bring back calcium from blood to bone. So, dinadala nila yung calcium sa bone. Yun yung purpose ng calcitonin. While yung parathyroid hormone naman, kinukuha niya si calcium sa bone, dinadala niya kay blood. So, another drug of choice kay osteoporosis is yung biphosphonate, alendronate, fosamax, o risendronate. Basta yung mga dronate. To administer this, dapat 1 tab before breakfast. So, bago ka mag-almusal. Another is you have to take it with 1 full glass of water. And then, dapat after you give the drug, o after mo ma-administer na yung drug, dapat si patient ay naka-upright o neutral position o high Fowler's position 30 minutes to 1 hour after giving the drug. And then document. So, yung biphosphonate alendronate, yun kasi ay phosphate binder. Bale, ang ginagawa niya is ini-inhibit niya yung absorption ng phosphorus sa intestine. So, kasi ang phosphorus and calcium ay inversely proportional. So, kapag decrease yung phosphorus, tumataas yung calcium sa blood. So, kapag mataas na yung calcium sa blood, doon na ibibigay si calcitonin para yung increased calcium sa blood, dadalhin niya kay bone. So, next is the assistive devices. So, tatlo yung assistive device na common sa NCLEX. We have the crutches, walker, and cane. So, start tayo sa crutches. Crutches is used sa mga patient na may sprain, strain, fracture, post-amputation, and congenital anomalies. So, ang measurement dito sa arm flexion, 30 degrees, and then sa weight, yung weight niya dapat yung weight mo ay dapat nasa arm bar. Hindi mo ilalagay yung weight mo sa axilla mo kasi it can cause brachial plexus nerve damage o crutch palsy. Again, yung weight mo ay dapat binibigay mo sa arm bar, hindi sa axilla. Kasi kapag sa axilla, it can cause brachial plexus nerve damage o tinatawag na crutch palsy. Start tayo sa 2-point gait. 2-point gait, this resembles robot walking. So, ang gagawin mo dito sa 2-point gait, opposite yung gagamitin mo. Yung crutch mo sa right, and then yung leg mo sa left. So, sabay yon. So, ilalakad mo ng sabay yung right crutch at left crutch na lang, left crutch, and then right foot ang i-advance mo. Ayan. So, then, next, yung right foot mo naman, ay yung right crutch mo naman, and then yung left foot. Alternate lang, pero sabay sila. So, this is indicated for the mild bilateral weakness lang naman. And then B, 3-point gait. Ang tatandaan natin dito, 3:1. So, gagawin dito, yung dalawang crutches mo, igagalaw mo siya, yun yung i-advance mo along with the affected leg. Then, saka may susunod yung good leg mo. So, ito yung i-advance mo yung dalawang crutches mo with your affected leg, with your ito pala, i-advance mo to with your affected leg, and then isusunod mo si unaffected leg. So 3:1, yung 1 yung unaffected leg mo. So this is indicated for patient with non-weight bearing. Next is 4-point gait. 4-point gait naman is slow and alternate. So, kunwari, ang i-advance mo, ay dito, i-move mo lahat separately and opposite. So, i-advance mo yung right crutch mo, left leg, left crutch, right leg, ganon. So, alternate. Ayan. And then, swing through is i-advance mo yung crutches mo, then followed by both legs. And isi-swing mo yung both legs mo beyond the level. So, lagpas pa siya. Through lagpas pa sa crutch. So, this is indicated sa mga amputees o yung mga patient na they does not bear weight at all. Next is swing 2. Dito, pantay lang. So, i-advance mo yung dalawang crutch mo, tas isusunod mo yung dalawang legs mo pantay sa crutch at the level of the crutch. Ayan. Ito kay Mark, ito. Using crutches when going up and down. So, kapag up ka, good leg ang uunahin mo. So, good leg, then both crutches with unaffected leg. Kapag down ka naman, both crutches with affected leg, then susunod mo si good leg. So go up with the good and down with the bad. So bali pag mag-up ka, good leg, then sunod si crutch with affected leg, then kapag bababa ka, crutch with affected leg, then good leg. Okay? Up with the good and down with the bad. So, sa tip naman kay Mark Klimek lecture, yung mga even point gait for even, odd point gait for odd. So, even numbers like 2 and 4, when weakness in the feet is evenly distributed. Ayan, even. O yung ito yung mga bilaterally and systematic yung mga disorder, kaya sila naka-crutch. For example, sa 2-point gait, dito yung mga mild problems lang. Yun yung mga early stages. Kapag 4-point gait, severe yung problems dito, and indicated siya sa mga post-op. Yun. Ulitin natin. Sa 2-point gait, mild problems lang. And kasi nga even number sila, so 2 and 4. Dito yung mga problema is evenly distributed, so systemic and then bilateral. Parehong may tama. So sa 2-point gate, dito yung mga mild problems. And then early stages pa lang. Sa 4-point gate, dito yung mga severe na yung problems. And then new post-op. Next, yung odd number gate, like 3. Kapag isang leg lang yung apektado. So sa 3-point gate, one leg lang yung affected, and then partial lang yung weight bearing nila. So kunwari right hip o knee, ganon, partial weight bearing lang, partial lang. And then swing through if hindi ka nakapag bear ng weight. And then yung mga amputated, yan lang naman yung tatandaan natin. 3 for partial weight bearing, and then yung mga one leg lang. And then swing through kapag hindi ka nakakapag-bear ng weight, at saka yung mga amputees na yan, amputation. So dito tayo sa walker. So walker, this is used for patient na may problem in maintaining balance. So the proper use of walker, tatandaan natin yung word na wafu. So walker, then affected side. So you should advance the walker along with the affected side, and then followed by the unaffected leg. So walker, walk with affected side, and then followed by the unaffected leg. The measurement, of course, lagi naman sa arm flexion is 30 degrees, and then ang distance is 8 to 10 inches forward. So for the cane, this is used for leg weakness. Tatandaan natin yung word na cold. Cane, opposite, affected leg. So ang gagawin is hold the cane on the good leg. So yung cane natin dapat nasa side siya ng good leg, and then ilalakad mo siya, o i-advance mo si cane with the opposite side. So yung cane na nasa good leg, so advance cane with the bad leg, and then ayan, cane opposite affected leg. So hold cane on the good leg, then advance cane with the opposite side. So yung hand grip mo dapat is nasa waist level, and then the measurements, of course, arm flexion is 30 degrees, and the distance is 6 to 10 inches forward. So yun lang yung last. Queen Peñaranda, US Open.